We've done some innovative programmes in the Northwest. We've got a longitudinal integrated foundation and physician associate training programme, which trains workforce members differently, so they have insight across the healthcare system. So they train in the primary and secondary care setting together over a longer period of time. They build collaborative relationships with the supervisor over a 2-year period, and they build a better relationship with patients, a patient cohort from the GP practice over a 2-year period. So they have a cohort of patients which they follow through the healthcare system from primary care setting across to the secondary care setting. So maybe in the primary care setting they see the coughs and colds, and then they go to the community respiratory clinic and they see the patients with a respiratory nurse, and then they follow the patients that have had respiratory difficulty into the A&E department, and then into the hospital admissions, and then in the hospital respiratory ward, the endoscopy clinic, the respiratory outpatient clinic, and then back into the primary care setting. So they have a better collaborative relationship with their supervisors and with their patients that they look after and support, and that's an over a 2-year programme. Yeah, so the physician associates are, they're by definition, because this is a new role, this is a new profession, they're innovative, they're young, they've taken the leap of faith to go into the profession, 50% from the healthcare backgrounds, 50% new into the NHS. How are they being perceived? Well, there's a system change here. Some of the vulnerability is playing out. We've tried to empower our physician associates by upskilling them in the how, the collaborative relationships, the relationship system intelligence, how that works. And when they go into the healthcare setting, because they've had that upskilling, yeah, they are creating innovation, and they're creating good collaborative relationships, and they're impacting on patient care, so they're helping patient care, yeah. Yeah, patients receive them very, very well. You know, they're building very collaborative relationships with patients. So rather than the rescuer-victim-patient relationships, they're building empowered coaching, side-by-side dynamic relationships. So that the patients are receiving them very, very well. Yeah. Yeah, I think they are winning round the GPs and consultants over time. It takes time to socialise and embed a new practitioner, and that is happening. And I think in the future we'll see more and more physician associates come through. So yeah, wonderful.